I'm home from Animal Care Expo. I'm going to get into day 4. So the 3 classes that I took on the last day were vetting protocols, grant strategies, and behavior for long-term stays, specifically medical. So I'm just going to jump right into it. Starting out with the first class, it was called Protocols for Those with Limited Vet Support. Now they did actually give us a handout with actual protocols that we should have in place. I guess side note, it was put on by best friends, but they did start it out by saying that a successful medical program does have a formal relationship with a vet. They also have trained personnel, and then they also have evidence-based protocols in place. And so this class was mainly targeted at the latter, the evidence-based protocols. So there's a couple of things that we need to address as a whole before we can really get into the exact protocols. So first and foremost, making sure that we have proactive population management, getting into a little bit more of the vetting, making sure that we have prevention, diagnosis, and treatment available, making sure that we have suitable housing, also prioritizing stress mitigation. We also need sanitation. And the last one is infectious disease management and surveillance. So if you are an organization that does have limited resources, or maybe you don't have a formal relationship with a vet because you are rural or whatever the case may be, the number one thing that you need to consider is decision making and communication. So you should have a vet at least consulting so that you do have approved protocols, they can perform surgery, and they can do the diagnosing and prescribing. However, your techs and staff can be trained to do absolutely everything else. So they could be doing preventative care, they can do health monitoring, treatment, surgery prep, the basic communication, documentation, all of that good stuff. You also have to have a smart strategy. For a lot of these things, volunteers can do them if they're trained. And they were mentioning that a lot of organizations don't actually use their volunteers. So if you have limited medical staff and the budget's tight, train your volunteers. But at the end of the day, we want to ask ourselves, especially if you are in a position of power at your organization, what tasks are always draining the most time and resources from us? What is not going to change the outcome? And then how can I save resources but also improve flow? So one of the main things that they kind of honed in on, and they gave us a couple of different case studies, and like I said, they also gave us a handout with specific protocols to have in place. But one thing that I felt was kind of universal across all of the case studies was the use of doxy. So I think a lot of us, myself included, sometimes we feel like, oh my gosh, the dog is sick, we immediately need to go to the vet for testing. And honestly, if something like parvo or distemper is of concern, then yes, definitely test. But a lot of times organizations just automatically jump to testing or doing a fecal, and honestly, all you really need to do is doxy. If they aren't improving with the doxy, then yes, of course, we go back to the drawing board, we do a fecal, we do other kinds of testing. But honestly, doxy should do the trick. It often does do the trick, and so if you can start with that immediately, that's gonna be way cheaper than going straight to testing. Another thing they mentioned is building a protocol library with your vet. So if you don't have like full-time access to a vet, maybe they only come in a couple of days, maybe you just have like a partnership at another clinic that you have to physically go to. Whatever the case may be, just make sure that you set up protocols so that you know exactly what your staff should be following. So like I said, your volunteers and your staff can do a lot of these things without the vet, but you do need to have protocols in place from the vet so that you know when it gets serious enough that you do need to involve the vet. But the last thing that they really honed in on, and honestly all of the presentations have mentioned this in one way or another, is that having medical protocol is just as important as having stress management and behavioral modification, and all the extra things that go into animal care. They did point us to fear-free shelters resources, but as we all know, if you have dogs that are extremely stressed, that can cause lots of these symptoms that we're seeing. So as much as we can have stress management alongside the vetting care, that's really going to take you a long way. Okay, I'm going to move on to the next one, grant strategies. Actually, I knew this presenter as well. We had connected on TikTok, so small world. One thing that she said that I absolutely agree with is that competition is often insane, especially in animal welfare, so your application really has to stand out. I will say, just from my own experience and the way that I like to do things, I didn't necessarily agree with everything, but something new that I did learn is doing grants by using 990s. So when you find grants, again, you can go like Google or the databases out there, social media, maybe even referrals. But once you do find a grant that you are interested in and you feel like aligns with you and your values and your mission, then you want to go look up their 990. I'm pretty sure I've mentioned this in past videos, but essentially you can go to either ProPublica or GuideStar. So when you pull up their 990, you want to look at part 14. On part 14, it's going to talk about the grants that have been given, the purpose, and the amount. It also gives location and focus area, so you might want to look at that as well. But essentially, we're looking at this to see if it's even worth your time to submit. Now, I think we've kind of all seen it where a grant will say like, yeah, we accept applications from anywhere in the world. But then you actually see who receives the grants, and it's like all California or all Nevada or whatever. Or like in my case, a lot of times on the website, it'll say like, we grant awards up to $20,000. But then if you go and you actually look at what's been granted to other organizations, it's closer to like 5 to 10,000. So anyways, you just want to take a look at that to see if it actually is aligned and if it's actually a good idea for you to submit, and then that way you have a little bit of guidelines as well. Another underutilized one is private foundations. You can also 990 check this one. The number one question you want to ask yourself is, do they accept unsolicited applications? So on the 990s, there's actually a box that says this. If the box is checked, that means no. And if it's not checked, that means yes. So long story short, you're looking for 990s that are unchecked. Directly under that, they will have contact information if they accept unsolicited. She did say it's a good idea to try and make contact before you actually submit, just so that you can kind of build that rapport. And then also, again, this is another thing that was like a theme throughout the whole conference. But honestly, as a whole, all of us organizations, all of us nonprofits, especially in the animal welfare space, we need to stop convincing people. They already want to help. We just need to be direct, and we need to tell them why we deserve their money. And then I know this one's been short, but the last thing that I wrote down is about the grant itself. So when you actually sit down to write this, you really want to think about, is this problem or is this solution based? Sometimes when you go problem based, it's just like social media, it kind of turns some people off. But when you can be solution based, it actually really encourages people to get involved with your mission, and it seems something a little bit more uplifting and something that they feel is attainable. Okay, like I said, I know that one was short. This next one's also going to be short, not because of a lack of information, just because a lot of it was actual videos that she put on screen. Now this last one was about behavior modification, primarily for long-term stays, but also primarily for like medical dogs. So anyways, it was all about cooperative care. And cooperative care, if you don't know, is basically the animals voluntarily participating in their own care. Now, the thing that I like about this, because, you know, at this exact moment, we don't really have any medical dogs, but teaching them these things can actually reduce stress. It's both training and enrichment. It actually provides control, choice, and consent, which all leads to confidence, which is exactly what all of our dogs need. Now, there's a lot of examples. She gave a list of like 30 things, but some of like the most common ones that maybe somebody at home might want to do is preparing for like nail trims, doing ear swabs or ear cleanings, taking their meds or getting vaccines, and also just like a head rest. I think she called it a chin rest, but basically you want them to have them put their chin down on a chair or even just on the floor. That way you can examine the rest of their body and do whatever you need to do. So approximation, it's essentially the steps that you need to take in order to make it easier to reach the final goal. So, you know, we don't go straight for cutting their toenails. We want them getting used to us like putting our hands closer to their paws. We want to actually touch their paws. Then we want to lift their paws up. Then we want to just touch the nail clippers to their paw. And then we actually want to cut their nails. So basically it's just a lot of little tiny steps, but we want to make sure that we have fully mastered one step before moving on to the next. Another thing is making sure that you give control. And so she mentioned two different ones. Sometimes you will ask for the chin rest, but you can also use sit as your consent. And essentially at any point during the procedure, if they lift up their head or if they stand up from their sit position, immediately the procedure stops. Whatever you're doing, it has to stop. And that just kind of gives them control. It makes them feel like they are consenting to the procedure and they feel like they have some semblance of control, even though they might not. I am actually a big fan of this, primarily because in my rescue, I noticed that the dogs do much, much better once we establish that bond, and they're kind of doing things voluntarily because they want to please us, if that makes sense. So that was all that I had written down, but I will say all of the videos that she provided were very, very helpful. And essentially it's exactly what I just explained. You know, you don't just start with adding, she used a Dremel. So you don't just start with a Dremel. You know, first you come in and you're trying to get them desensitized to you touching their feet. Do it a couple times. Another thing that I will say that she did mention, because she did show us like different preparations for different procedures that they had coming up. And so I feel like when we started the conversation, it was a lot more about like, we just want to teach this as a way to enrich their lives and kind of do behavior modification, but also if they do have future vetting appointments, that they're kind of like prepared for them and they're very good dogs at the vet. It also makes them more adoptable. But then once we started watching the videos, I think it became a little bit more about like this one dog, she had gotten into a fight and she needed to have ointment applied to the top of her head, but she was very aggressive when people tried to touch her ears. And so then it was kind of like they couldn't take it slow because it was so imminent. Like they needed to put the medication on top of her head like right now. So then it was like, okay, how can we progress to the final step and not need all the little tiny steps in between? And there were a couple of other cases like this. There was another one, the dog was pretty aggressive, but he had just entered the shelter and he needed all of his vaccines. And so same thing there, they were kind of very quick to move the process along. But I think just as far as this whole process goes, I think it's very, very useful to teach any dog this. I think, you know, I can speak for myself with my personal dogs. The vet is not our favorite place to be. One of my dogs needs to get sedated when she goes in. So I will say that doing these kinds of things definitely makes them more adoptable because they're much more manageable. But like I said, it also builds up a lot of confidence in them. And I think that's what almost every single rescue dog needs. That's what every dog in general needs. So overall, I wish that I could show you the videos that I got to watch, but recording was not allowed. But if this does sound interesting to you, look up Cooperative Care and watch some of those training videos. They are essentially the same thing that I watched there in person. Okay, that is a wrap on Animal Care Expo 2026. It was a time, but I'm so happy to be home and jump into the next thing. So stay tuned. I have 2 long form videos that I filmed for you guys in a lot better lighting situation going on. So I will see you when I see you.